everyone, and Happy New Year. We are going to be talking about, if someone has gone through a surgery, there's all trauma and all the pain that is associated with surgery. How do you recover after that? Normally, I'm not a doctor, of course, but typically, the doctor will tell you bed rest and all that, but there is another way. So that's what we want to talk about today with Dr. Nell, who's joining me from acupuncture can help with post-surgical recovery. That is what our topic is today, how acupuncture can help with someone who's gone through surgery. Hello, Dr. Nell, how are you?
Hi, good. How are you? Let me just get this camera fixed so we're good to go. Hi, thanks for having me.
Absolutely. Well, welcome, Dr. Nell. Dr. Nell is an acupuncturist, and maybe you can tell us a little bit about yourself, and then we go into the topic of how acupuncture can help with post-surgery recovery. That is the topic, guys. All right, please go ahead.
Absolutely. So I actually got into this area of acupuncture specifically with post-surgical recovery because when I was 22, I was suffering from really chronic, debilitating pain. From many gymnastics injuries. And I was working in the physical therapy field and I was deciding, am I going to go to med school? Am I going to get my doctorate in physical therapy? What's my next career path? But I knew the pain was not sustainable and I was doing everything that conventional medicine was telling me to do, getting lidocaine injections on a regular basis just so I could do my job. And someone recommended acupuncture. There was an acupuncturist who was in our office and I knew nothing about it, had never tried it before, but had patients who were, going through the recovery process from injury and from surgery, and they were having great success with the acupuncture. So I ended up trying it, and it was the first thing that sustainably took my pain away and allowed me to learn my body a little bit better. That was exciting for me to then want to go into that field, because I saw an opportunity to help patients from a broader perspective, to open up my scope of practice a little bit and discuss more than just the rehab from an exercise standpoint, but also, your stress, your diet, your rest, your sleep, your energy, how all of these things factor into your recovery. So.
It's fascinating, and I can vouch for acupuncture because I use acupuncture. I had a shoulder, frozen shoulder last year, a couple of years back, and I could not even lift my arm.
Yeah.
It was so bad, and now look at not that I want to, but I hear you, and I'm like big proponent of acupuncture. But today we are talking about the post-surgery, so that's a little bit different than. You and me, we're healthy people, and we have a little bit, crack here, this here. But someone who's going through surgery, it's also the trauma, right? The mental trauma. There's a lot of other things going on. So let's talk from a mindset point of view, what's going on for someone who's going through a surgery, and then acupuncture from that point of view.
Yeah. So it's interesting because at least, in the US, standard of care is, you go for your post-op appointment, you get your surgery, and then a lot of times, depending on the type of surgery, you're not left with a lot of recovery options.
Yeah.
And a lot of things you have to wait on. Like if I have a patient with a tricep repair, and that's an orthopedic surgery, and he had to wait 2 months for physical therapy. So what are you doing in that process? And it can be really disempowering for patients where they think that, okay, I'm just going to be on bed rest and taking pain medication and I don't really know what to do.
Yeah.
So when we're looking at what actually happens physiologically, mentally, during a surgery, there's a lot of things, particularly mentally, as you said, that don't get discussed. Like one of the main side effects that I see after surgery is memory loss and anxiety from anesthesia toxicity.
Yeah.
So, people are very nervous, rightfully so, going into a surgery, whether a surgery is, necessary and life-saving or whether it's elective, there's still a trauma that occurs in the body. And that's, a physical trauma, but it's also an emotional trauma. Surgery is not natural. It's amazing that we've had these advances and we're able to do these surgeries, but nothing invasive like that, changing the physiology is natural, and the body wants to come back to that state of homeostasis. And how can we do that in the best way possible? So the mental aspect of it is huge, because there's a lot of stress and anxiety leading up to the surgery. And then in that recovery process, particularly because of the anesthesia, I see a huge increase in anxiety, depression, insomnia, people even questioning, oh my goodness, should I have even gotten this surgery? This is not good. I'm not sleeping. I feel awful. I'm questioning everything. I can't remember things. And a lot of times, unfortunately, those patients are not told that that's a normal thing that happens with anesthesia, because even though anesthesia is so important for a surgical procedure, so you don't fully experience it, consciously, it still is a neurotoxin that affects the body, that needs to be processed out, because you don't need it once you're done with the surgery.
Yeah, exactly. So let's talk, so acupuncture, I think all of us know, is inserting the needles, and traditional Chinese medicine is much more than acupuncture, as you know. So what, in your opinion or in your practice, do you also use acupuncture with other modalities, other therapies within the traditional Chinese medicine arena, is like qigong or moxibustion or cupping? I mean, how does this on a very high level come into play and help calm the anxiety, what you talked about? That's one thing from a mental point of view. Then there's also toxicity that's gone inside the body, right, from the anesthesia point of view. So do you combine different things, or do you just say only acupuncture? I mean, how would you kind of lay out the framework is what
Yeah.
Yeah.
So it's different for each individual. Acupuncture for everyone, absolutely. But depending on the type of surgery, certain surgeries cause more physiological trauma than others. Certain surgeries cause more fluid accumulation. Herbal medicine, cupping, these are things that are really helpful for activating the lymphatic system and helping process out fluids and inflammation. Acupuncture really, just like the healing process, you adjust it based on what the person needs at that time. So for example, I have patients who come to me before their surgery and they say, I have a history of addiction, or I have issues with opiates. I don't want to go on pain medication after the surgery, and I'm well aware that it's going to be painful. What can we do? And then that's a primary focus. There are some patients who, they're athletes and they have to get back to their sport or their event in a certain time frame. Or just the average person who does not want to spend longer than necessary recovering. So there's all different ways you can target it. And it's really, just like traditional Chinese medicine is an entire system of medicine, it's so based on the individual's needs, and what their goals are, and also how they present before surgery. And even though I work primarily with people recovering from surgery, the ideal situation is to see me before the surgery as well. So we can see, where is your baseline? What are your patterns? The systems that we really need to be mindful of, because a naturally, deficient, run down person is going to recover very differently from the same surgery. Like if they have an ACL reconstruction, they're going to recover very differently than a person who has all of this excess energy and they heal really well, and they're super strong and have this fortitude. And to see that before the surgery, before you have the chemical impact of the anesthesia, before any wound healing is happening and the body's responding physiologically, that's really helpful too, to dictating that treatment plan. Are we going to include herbs, acupuncture? And then something we have to also be realistic about, particularly in the US, this is the way our healthcare system is set up. So there are going to be, you want to work with this surgeon, you want to work with these doctors, because, you don't want to do anything to upset them. I have patients who come back and the doctors are amazed at the results that they've gotten, but if they're not someone who's totally comfortable with herbs, or they don't know anything about herbs, that's a conversation that should happen with that doctor to help educate them, rather than just doing it and hoping for the best. Ultimately, it is the patient's choice, but I'm someone who works very integratively, and I don't think that we can progress in this healthcare system without having those key conversations.
Yeah, I think you made a very good point. I think the education, right? It's not only the doctors are, of course, surgeons, as you know. Not that I want to make any comments, but they help a lot, for all the society, people who need acute care. But in medical schools, it has been shown that they're not taught nutrition, they're not taught the herbs, so it's not their fault. They're practicing what they're taught, right?
Right.
And this integrative medicine is now becoming very popular because of the users, people like us, who are now questioning a lot of things, right? So,
Yeah.
So there's a lot of education to the end users like ourselves who that needs to happen, which we are trying to do right now, and also from a from a surgeon point of view. So let's explain us a little bit, because we want users to understand how acupuncture works. So let's just take an example. So we talked about anxiety or something. So maybe we talk about a certain point, right? 1 or 2 points that you would just explain to the user how would it work, so that they understand the acupuncture actually works, right? That's the goal of our session, that we want people to understand. So let's just talk about anxiety. There would be like what point, or just something maybe on an acupressure point of view, 1 or 2 things that you could just tell us.
Oh, yeah, sure. I mean, I can give a couple examples if people are looking specifically to work with anxiety. But like a preface to that is, because Chinese medicine works as a systems-based approach and a patterns-based approach, what might be causing your anxiety is different from what's causing my anxiety. And even though they might present in the same way, we're both saying, oh, I get really racy at night and I have heart palpitations, and when I get stressed, I feel really flushed. But the underlying pattern, that's why it's really important to have a practitioner. But some really good, like basic, like let's calm down acupressure points. There's a few on the feet that I'm not able to show, but a really common one that people love is called yin tongue. It's right here. It's your third eye. That point is known to stimulate melatonin in your pineal gland. So really helpful for people who get anxious in the evening and are looking to calm down for sleep. People who get really stirred up when things are very busy and stressful, this point at the hairline is really beneficial. It's also a really interesting point for allergies. So you think of like wind, right? So nervous, anxious energy, or physical wind that causes allergies, like that's a really great point. Auricular acupuncture on the ear is probably the most effective for anxiety, depression, anything nervous system related, because vagus nerve goes to the ear and you can treat anything in the body from the ear. As far as how acupuncture works, I always like to explain it as acupuncture is an adaptogenic medicine. So you think about adaptogenic herbs, like, oh, I'm going to take ginseng, and all that's going to do, it's non-specific. It's just going to help your body handle stress better. So we always have to keep in mind with natural remedies, like our body is so intelligent, more intelligent than we are. Our body wants to heal. Our body wants to be in balance. It wants to get better. So sometimes you just need like a little gentle nudge in that direction. And some of these points have been studied with, functional MRIs. And so we can see like how it improves the blood flow, where things move along the so-called acupuncture channel, how, this point helps with frontal headache. And we can see over a period of 20 minutes how that increases temperature and circulation and moves up to the face. That follows pathways that we see in text that's thousands of years old, which to me is absolutely amazing that they could see that, and now we're confirming it with modern lab tests. But yeah, the main thing with acupuncture is it's adaptogenic. It just reminds your body, hey, you already know what to do. Reminds your body of what it feels like to be in balance. Just like when we think about muscle memory, we think about learning how to ride a bike. It's practice. It's reminding ourselves how to do it. So that's why when people are just like, I get acupuncture once a week when I feel really good, when I'm just trying to maintain stress, keep anxiety in check with the pandemic, make sure I'm staying healthy for myself, my patients. And then if people have something acute going on, they're coming a few times a week. And that doesn't mean, you have to come a few times a week forever. It just means that there's a dosage for everything. So when patients say like, oh my gosh, it's going to take 20 sessions for my back pain to completely go away. And I said, well, you've had back pain for 20 years. And how many doses of your medication have you taken over 20 years? And so when you think about the dosage component, 20 sessions is like not that much to have a problem completely resolved that's been around for decades.
No, I think that's a very good example, the way you explain how acupuncture works. And now, coming back to the post-surgery or a general trauma, a general anxiety, I would say that, are there any common herbs, or let's put it this way, do you also combine, you said it's personalized, right? Someone might need the herbs, someone might not need the herbs. But on a general level, on a very high level, what are the just one or two common herbs that you have used in your practice?
So actually ginger is a huge one. It's a big herb in Chinese medicine, but also, very commonplace, very effective for the nausea that often accompanies surgery. When you're detoxing from the anesthesia, ginger is a very harmonizing herb. So it can be really effective when you're trying to process out toxins, when you're reintroducing things into your body and still trying to clear out some of the things from surgery, just to feel, a little more harmonized, a little more balanced, help, a lot with that. Usually I'll do herbal formulas, so it will be combinations of different herbs for the individual. But, I have people who are literally sucking on ginger after a surgery because they don't want to take medication, to prevent vomiting. Like they don't want to take medication for those things, or they're looking to get off of medication sooner. So we can do that too. I think that's really important to note with herbal medicine. And some herbs are safe to pair with medications and some are not. So again, like why you need, a practitioner. And turmeric is really good for specific patients. So the only time I wouldn't really recommend turmeric post-surgery, if someone had a huge traumatic surgery where there was a high risk for bleeding, and if they're like still in ICU. That's not how I typically see patients. Like usually I see them the day after surgery when they're either at their home, they're at a hotel. And usually by that time, like turmeric starts to be a little bit safer because it can be helpful with the pain and inflammation. And so particularly for people who are trying so hard to not be on pain medication, but obviously, they have a trauma that is healing. They have scar tissue that's trying to form, inflammation that's trying to clear out. Those are two really great ones for right after surgery.
That's great because turmeric has a lot of, it's like the star child of the herbs, right? That's the queen, right?
It's like everything.
Yeah, it's like you take turmeric, you see the papers, and any it's on the cover, like it's the showstopper, right? That's what I call turmeric right now. It's the showstopper of the fashion show of the herbs, right?
Yeah, exactly. And I think like quality is really important with that too. And there's a difference between, general health cooking with these herbs and then medicinal dosing. So that's, and the way it's delivered, like a lot of times with patients who really need a potent anti-inflammatory that, are trying to use turmeric for migraines instead of migraine medication, I'm going to prescribe an emulsified turmeric at a high dose that's going to get into their system well, and, digestion isn't going to block it too much. Whereas, for general health, it's great to be cooking with these herbs and incorporating them into your diet, because who doesn't need less inflammation? It's the root of all evil.
Yes, absolutely. But you would prescribe these particular supplements is the difference. Specifically someone, who's had surgery before and they need to calm their pain and calm their system. Now, what about meditation or qigong or something equivalent to what yoga has? Do you also prescribe some simple meditating exercises, something to calm the nervous system?
Definitely. And breathing exercises as well, which can really help, with vagal tone, can help with parasympathetic, because, if our body is in this like really heightened sympathetic response, we need that at times. But for recovery, you have to bring it back down to parasympathetic. So if someone's laid up in bed and they aren't in a position where they can really get up, breathing exercises can be really helpful. Meditation can be really helpful. And also the power around a lot of this post-surgery is that patients feel empowered.
Yeah.
They feel as though they actually have something that they should be doing every day instead of just laying in bed, watching the clock tick, waiting to feel better.
Yeah.
So to be able to meditate, a day, a few times a day for 5 minutes at a time, they know like, oh, that's part of my recovery schedule. And, even to be like, okay, well, I'm not having my next acupuncture appointment until tomorrow, but Dr. Nell told me to do these 3 acupressure points and to do this breathing and to take my herbs. So they feel more involved in that process and not just like, okay, you need to wait until you're better. And a lot of times, unfortunately, that's what patients are told. Like, it's like, well, you're going to go to physical therapy in a month. Until then, stay in your brace. And I think it's also important to note, a lot of this is not dependent on having access to the local area where you had surgery. Because I think that's something that really makes people nervous with needles. They're thinking, oh my gosh, I had a C-section and you're going to stick needles in my abdomen.
That was the next question I was going to ask. That, someone just put a C-section on a woman and now you start again sticking the needles. I'm like, oh, people would be very nervous, right?
Absolutely. And I would be nervous too. I wouldn't want that, and no, there are stages to that healing. There's definitely work that can be done locally with scar tissue, but that does not get done, 2 days after surgery while there's still angry inflammation, while you're still healing. Immediately after surgery, we're first looking to help process out the trauma, help process out the anesthesia and the toxicity, help your organs, your nervous system function optimally, because again, the body knows how to heal from things. So if we can get you in a good state where your body's like, oh, okay, I'm going to start healing, I'm good with this, then we can start working a little closer to local. And we can work on the pathways and nerves that innervate that area without going directly to them. I do a lot of spinal needling. So nerves come from the spine and they wrap around the body, they go down the body, and you can very easily treat a couple vertebrae that have nerves that eventually go down to the knee, and then you're not touching the knee whatsoever. And people are still getting benefit from healing without having the local area where they're nervous and sensitive touched.
Yeah, no, I think that makes sense. The distant needling is right. That's what you call it. Yeah. We had a session on distant needling, and it's fascinating, how distant needling, like they had mapped the entire brain, and how inserting some of the needles in your head can help, cure or start healing someone who suffers from paralysis. Absolutely fascinating. All right, we are almost at the time. So to summarize, acupuncture, acupressure, herbs, and meditation. Anything else that you would like to add?
No, I would just say don't be stuck in the mindset that, you have to do this alone. There are a lot of practitioners that can help work with post-surgical recovery. I really enjoy pairing people up with great practitioners. I'm here in Beverly Hills, but like I do a lot of advocacy work and a lot of consulting, so I know practitioners everywhere. So if anyone has questions and they're looking to get linked up with someone in their area, I'm happy to feel free to send me a DM, because I think we all should be supporting each other and promoting each other and what we do, so patients can get the best care possible and be educated.
Absolutely. Well, thank you so much, Dr. Nell, for being with us. Yes. To all the people who are watching, this show was about post-surgery. I saw people joining at different times. and we talked about acupuncture, or Chinese herbs, and meditation. These are the three tools on a very high level. That's what we talked about. But let us know how you're doing, and thank you so much for being with us, and Happy New Year.
Thank you so much. Happy New Year to you too.
Bye-bye.
Bye.